acoustic nerve. Just before the facial nerve emerges from the stylomastoid foramen, it generally receives a twig from the auricular branch of the vagus. After its exit from the stylomastoid foramen, the facial nerve sends a twig to the glossopharyngeal, and communicates with the auricular branch of the vagus, with the great auricular nerve of the cervical plexus, with the auricular temporal nerve in the parotid gland, and with the lesser occipital behind the ear, on the face with the terminal branches of the trigeminal, and in the neck with the cutaneous cervical nerve. Branches of distribution. The branches of distribution of the facial nerve may be thus arranged: with the facial canal, nerve to the stapedius muscle, chorda tympani, at its exit from the stylomastoid foramen, posterior auricular, digastric, stylohyoid, on the face, temporal, zygomatic, buccal, mandibular, cervical. The nerve to the stapedius, nervus stapedius, tympanic branch, arises opposite the pyramidal eminence. It passes through a small canal in this eminence to reach the muscle. The chorda tympani nerve is given off from the facial as it passes downward behind the tympanic cavity, about 6 mm from the stylomastoid foramen. It runs upward and forward in a canal, and enters the tympanic cavity, through an aperture, iter chordae posterius, on its posterior wall, close to the medial surface of the posterior border of the tympanic membrane, and on a level with the upper end of the manubrium of the malleus. It traverses the tympanic cavity, between the fibrous and mucous layers of the tympanic membrane, crosses the manubrium of the malleus, and emerges from the cavity through a foramen situated at the inner end of the petrotympanic fissure, and named the iter chordae anterius, canal of Hugier. It then descends between the pterygoideus externus and internus on the medial surface of the spina angularis of the sphenoid, which it sometimes grooves and joins at an acute angle the posterior border of the lingual nerve. It receives a few efferent fibres from the motor root. These enter the submaxillary ganglion, and through it are distributed to the submaxillary and sublingual glands. The majority of its fibres are afferent, and are continued onward through the muscular substance of the tongue to the mucous membrane covering its anterior 2/3. They constitute the nerve of taste for this portion of the tongue. Before uniting with the lingual nerve, the chorda tympani is joined by a small branch from the otic ganglion. The posterior auricular nerve, nervus auricularis posterior, arises close to the stylomastoid foramen, and runs upward in front of the mastoid process. Here it is joined by a filament from the auricular branch of the vagus, and communicates with the posterior branch of the great auricular and with the lesser occipital. As it ascends between the external acoustic meatus and mastoid process, it divides into auricular and occipital branches. The auricular branch supplies the auricularis posterior, and the intrinsic muscles on the cranial surface of the auricula. The occipital branch, the larger, passes backward along the superior nuchal line of the occipital bone, and supplies the occipitalis. The digastric branch, ramus digastricus, arises close to the stylomastoid foramen, and divides into several filaments, which supply the posterior belly of the digastricus. One of these filaments joins the glossopharyngeal nerve. The stylohyoid branch, ramus stylohyoideus, frequently arises in conjunction with the digastric branch. It is long and slender, and enters the stylohyoideus about its middle. The temporal branches, rami temporalis, cross the zygomatic arch to the temporal region, supplying the auricularis anterior and superior, and joining with the zygomatico-temporal branch of the maxillary, and with the auriculo-temporal branch of the mandibular. The more anterior branches supply the frontalis, the orbicularis oculi, and the corrugator, and join the supraorbital and lacrimal branches of the ophthalmic. The zygomatic branches, rami zygomatici, malar branches, run across the zygomatic bone to the lateral angle of the orbit, where they supply the orbicularis oculi, and join with filaments from the lacrimal nerve and the zygomatico-facial branch of the maxillary nerve. The buccal branches, rami buccales, infraorbital branches, of larger size than the rest, pass horizontally forward to be distributed below the orbit and around the mouth. The superficial branches run beneath the skin and above the superficial muscles of the face, which they supply. Some are distributed to the procerus, joining at the medial angle of the orbit with the infratrochlear and nasociliary branches of the ophthalmic. The deep branches pass beneath the zygomaticus and the quadratus labii superioris, supplying them and forming an infraorbital plexus with the infraorbital branch of the maxillary nerve. These branches also supply the small muscles of the nose. The lower deep branches supply the buccinator and orbicularis oris, and join with filaments of the buccinator branch of the mandibular nerve. The mandibular branch, ramus marginalis mandibulae, passes forward beneath the platysma and the triangularis, supplying the muscles of the lower lip and chin, and communicating with the mental branch of the inferior alveolar nerve. The cervical branch, ramus colli, runs forward beneath the platysma, and forms a series of arches across the side of the neck over the suprahyoid region. One branch descends to join the cervical cutaneous nerve from the cervical plexus. Others supply the platysma. End of section 30.